Back. Dr. Twyman's Ask Me Anything, Monday, 6 p.m. Central Time. I'm a board-certified cardiologist, and I help people not have heart attacks or strokes. So for the past 4 years or so, I've been doing these IG Lives on Monday night to help people optimize their lifestyle, talk about vascular health, talk about mitochondrial health, talk about photobiomodulation, biohacking topics. So always appreciate your guys submitting your questions ahead of time. These are questions I get routinely in my practice at Apollo Cardiology, located in St. Louis, Missouri. So if you're interested in having us one-on-one help you with your vascular concerns, just reach out to my practice at drtwyman.com and fill out an application. We're currently still booking out about 2 to 3 months into the future. So if you have something very urgent, maybe a little bit before we can get to you. But if you just want to make sure that your vascular health is low risk, or if it's not, what you need to do about it, let us know and we'll see what we can do to help you. So with that being said, we'll jump on right into some of the good questions tonight. First question up tonight, should you repeat a carotid ultrasound? If so, how often? So great question. If your carotid ultrasound, and I'm going to kind of split it up in that there's 2 types of carotid ultrasounds. The traditional one would be called a carotid duplex ultrasound. That's more looking at the flow of the arteries and looking for how much stenosis or blockage you may have. That's usually repeated yearly if it's abnormal. In my practice, I do what's known as a Carotid Intimal-Medial Thickness scan, or CIMT. That test will tell you if you have plaque in your arteries, but it also tells you how thick the intima is, which is the inner lining of the artery underneath the endothelium. If that layer is thick, you have vascular inflammation and you're more prone to developing plaque in your arteries. The CIMT is what gives you your vascular age, and as Dr. Thomas Sydenham had said, a man is as old as his arteries, so you want your arterial age to be under your biological age. If your CIMT is completely normal, generally every 12 to 24 months we consider repeating it. If your CIMT is abnormal, yearly to look at the intimal thickening and go from there. Is there genetic testing available to the public looking at genes that affect the heart? I don't know exactly, if you can order it yourself, but that being said, you also have to know how to interpret the results. So there are many vendors that offer some of this testing. I mean, old school, you could get your raw data off 23andMe and run it through these different algorithms, but I've honestly not seen that many great reports that can actually explain it to you. A lot of time the raw data is very complicated to understand. There's really only 4 major genes to start with, and then if you have a major lipid issue, oftentimes you need the GB Insight, which you have to have ordered by a medical provider because it requires a MPI number to be able to get those. But if you can get these tests, you want to know Lipoprotein A, 9p21, which is the heart attack gene, KIF6, KIF6, and ApoE as an echo. Those 4 are the big 4 that I usually check on most patients with family histories of vascular disease. Question about nitric oxide. How to increase nitric oxide? What foods to eat. So nitric oxide is a gas, short-lived, helps dilate arteries, prevents things from sticking to the arteries. We talk about filling up a nitric oxide funnel. You do that by exercising and blood flowing across the lining of your arteries, the glycocalyx, and nitric oxide gets released from the underlying layer, the endothelium. So exercise is one. UVA wavelengths of sunlight striking your surfaces releases nitric oxide. 3, foods rich in nitrates, mainly dark green leafy vegetables, spinach, arugula, kale, also beets, but it does depend on the soil conditions. If it's organic, great, you're not exposed to pesticides, but no nitrates are added to that soil. So you have 1/10 of nitrates in organic food compared to conventionally grown food. So sometimes it's very hard to get enough nitrates through diet alone. Then, based on testing, we consider nitric oxide supplementation. I usually favor either one of Dr. Nathan Bryan's lozenges or Calray's product, Vascanox. A 42-year-old woman with a recent calcium score of 0, when to test again. Great question. Depends a little bit on why you got the test. If it was just, hey, I just wanted to know, probably 3 years. But if you have a strong family history or somebody's had a heart attack in their 40s, 50s, probably every 2 to 3 years if you're really concerned. But I generally will not repeat calcium scores if they're above 0. But I would also, in the interim, be doing yearly CIMT scans. If I have access to endopads or pulse wave velocity, looking at arterial stiffness and nitric oxide scores, I would do that as well. And then do the radiation scans probably every 3 years. Next question. All right, I'll try to answer it. So how do I assess the influence of pharmaceutical industry on medical care, good or bad? Very complicated question. Probably needs a couple hours, but the short answer is, I did 10 years of training outside of college. Did I learn a lot about pharmaceuticals? Absolutely, you have to. You have to be able to speak the language of pharmaceuticals because they are tools that, in the right circumstances, save lives. You have to learn the biochemistry. You have to learn, basically, how everything coming into the system works. That being said, I don't think people are pharmaceutically deficient. There's something abnormal initially in your environment that you have to focus on. Blood work sometimes can point it in the right direction. Sometimes there's a nutritional deficiency. Sometimes supplements can work, but you want to reserve pharmaceuticals for the people who are higher risk. And then, you need to look at how things are researched. Many trials cost millions of dollars. So, who's going to pay for those? If you want a question answered, you have to find out who's going to, fund that research. So, I still read primary source articles. I can read the statistics. I was a math major in college. I have an MBA, so I understand numbers pretty well. And I come to my own conclusions. So that's how I assess the influence. What to do if you get a cramp in the back of your calf at night or on the street? Why does it happen? There's multiple reasons cramps can occur, but kind of general kind of thoughts is that if something's happening while exertion, you have to rule out that it's due to claudication, which is lack of blood flow to one of the arteries that's inflowing into the leg. You can do an ankle brachial index test to figure that out. It's blood pressure cuffs on your arms, blood pressure on your legs, and then measure the ratio. Your ratio should generally be between 1 and 1.4. If it's under 0.9, it's abnormal. But if you're having cramps at rest, sometimes it's an electrolyte imbalance, magnesium particularly. Sometimes it's just dehydration. So you generally want to have your BUN creatinine ratio on a blood test way less than 20, but ideally, in the single digits. And sometimes you can tell by your sodium levels if you're dehydrated as well. But a physical exam is necessary and often lab work to really figure out the causes. How to repair narrow arteries naturally. First, you got to figure out what's causing the damage. So you have to repair the glycocalyx, support nitric oxide pathways, number 1. Number 2, you got to keep oxidative stress and inflammation low. Number 3, you have to modulate your lipoproteins if they're abnormal. So can you do that with lifestyle? At times. Exercise is one of the tools. Nutrition, tool. Stress management, tool. Sleep, very important. If you don't sleep well, start there. Are there supplements that can help stabilize plaques? Yes, you listed a couple of them. Are there pharmaceuticals that could help? Yes. So you have to have a N-1 type of conversation with somebody. What other risk factors do you have? What's your biochemistry? What are your goals? And then you come up with a plan. Does diet soda contribute to heart disease? I don't know the literature that there's any direct link, but artificial sweeteners generally are not going to be great for the gut microbiome. And the diet sodas don't necessarily make you lose weight. Your pancreas essentially gets confused that sweetness coming in, and you eventually make up the sugar somewhere else. So not a huge fan of the diet sodas because they probably disrupt the oral microbiome as well. used to be a diet soda fanatic or addict, however you like to say, but eventually cold turkeyed soda, back in fellowship, and haven't had it in probably 10 years on any consistent basis. So nothing healthy in diet soda. So if you really need the caffeine, look more towards, teas, coffees. Does Raynaud's disease correlate with endothelial health? It can in some individuals. Raynaud's disease is generally an issue with small blood vessel circulation in the hands and feet, particularly in cold environments. Would the endopat be impacted? Yes. One of the reasons why our office generally has the patients covered with a blanket so that they're not cold and having their hands clamped down. If it's freezing outside in St. Louis, like it is right now. But if your hands are your normal temperature and the endopat's abnormal, then it just confirms what we expect. You have microvascular disease. As I stated earlier, you got to fill up the nitric oxide bucket. Often you're going to use more nitric oxide support in these individuals. You may use calcium channel blockers, sometimes long-acting nitrates, and then you do the comprehensive blood work to figure out, okay, what might be affecting some of the nitric oxide pathways. And then I think we got one more pre-Semitic question here. Can a low sodium and chloride level affect the heart? Depends on where the levels are at, but it's typically more that it affects brain health when your sodium is super low. Also, it can affect heart health. I mean, it is seen to have low sodium in heart failure, but it's not that you're low in salt, you're too high in water. The water dilutes the sodium and makes the sodium levels low. Would you need to add salt? No, you generally got to remove the fluids with diuretics and figure out what's, causing the fluid retention. Is it heart failure? Is it excuse me. Is it liver failure and you have ascites? Is it kidney failure? There's some other reasons why certain medications can cause hyponatremia. Some of the the psychiatric class of medications, some of the antipsychotics and antidepressants are known to do that. So it depends on what meds and supplements you're on sometimes. Would trace minerals help? Short answer is probably not. All right, guys. Some great questions tonight. And we'll go back and check and see what's in the comments here. Can high thyroid antibodies contribute to high blood pressure and insulin resistance? Not likely insulin resistance, but can contribute to high blood pressure, probably indirectly. There's three responses that the cardiovascular system can do to the infinite insults, as I was taught by Dr. Mark Houston. There can either be an oxidative stress response, there can be inflammation, or there could be autoimmune dysregulation. So Hashimoto's or abnormal thyroid antibodies, immune system's activated, attacking the thyroid. That inflammation can damage the glycocalyx of the lining of the arteries. That can affect the underlying endothelium. That can affect nitric oxide. Low nitric oxide, stiffer arteries, higher blood pressure. Gluten, often a co-factor in that situation, so avoiding gluten is often important for those individuals with thyroid antibodies. Red light from the sun, very beneficial at lowering inflammation, and avoiding artificial light. So things from like these screens, LED lights. You want to protect your thyroid, so get a shirt that you can zip up and cover your thyroid if you're in front of screens. Or there's companies that make thyroid shields that can protect your thyroid from the artificial light. Is Wim Hof's breathing technique safe for you if you have high blood pressure? Unknown, and I do not recommend Wim Hof's breathing technique. He's generally right on his teachings on cold thermogenesis or cold exposure therapy, but his techniques on breathing aren't based in science and would not recommend doing them. Next question. Person says they have a calcium score of 97, which is intermediate risk, particularly for somebody who's 66 years old. They're insulin sensitive. They have, quote, good blood pressure, but good blood pressure in my mind is 115 or 75 or less. Low carb, carbs, are earned, so it depends on how physically active you are, how much muscle mass you have. ApoE, is that 190? My white shirt's blocking that out. 190, okay. So initially 190. That would be likely familial hyperlipidemia, unless you had normal levels before doing some type of diet intervention. I've definitely seen the quote lean mass hyperresponders, who eat a higher fat diet and then they have that kind of response. But if you're taking medications and your goal level was 70, it seems that you're doing well with that. Should you go lower, the aggressive fifth percentile is 55. So possibly, depends on what else is going on. But it also depends on what meds they have you on. Oftentimes it takes 2 or 3 agents if you're really going to go for those more aggressive goals. It's often a statin or Nexletol to lower the cholesterol production, a PCSK9 inhibitor to support the LDL receptors, clearing the lipoproteins from the circulation, and then also generally ezetimibe to block the cholesterol from being reabsorbed in the gut. They always recommend D supplements during winter season. Do I agree? No. Is there a good D supplement? As a pill? No. Should I go deeper in that? Well, vitamin D is a hormone, and it's made when UVB wavelengths of light hit your skin, sulfate the cholesterol in your skin. That goes to the liver, gets turned on, goes to the kidney, gets finally turned on. But you're making hundreds of other compounds when sunlight strikes your skin. Throwing a pill in your gut is like telling your gut it's summertime. In St. Louis, it's snowing today. You would not be expected to have high vitamin D levels in February. So your goal is to use the sun to build up your vitamin D callus in the spring, summer, and early fall. And your vitamin D is stored in your fat through the wintertime and slowly released. You can eat foods that are high in vitamin D if you want. You can eat mushrooms, you can eat fish, eyes and all these things that have vitamin D if you want, but you're not naturally supposed to have super high vitamin D in the winter. You would have had higher melatonin in the winter because you would have had more darkness. You would have had more availability to essentially hibernate and sleep in the winter. So melatonin should be higher in the winter, lower in the summer, and then vice versa in the summer. Higher vitamin D in the summer, lower melatonin because their light cycles are longer in the summertime. Somebody's asking which arm should they take their blood pressure on? The shorter answer is the arm that has the highest blood pressure. So everybody should start by checking blood pressure in both arms. Most people's blood pressure will be relatively similar, but if you have a 20-point delta in the blood pressure, you may have subclavian stenosis, which is a blockage in the artery under your collarbone, and so you'll have a falsely low blood pressure to that arm. Or you have an issue with the nerves in your neck that's impacting the sympathetic tone of the smooth muscle to the artery to that arm. So if you're in a lot of pain, you're going to have a falsely high blood pressure in one arm. So you do want to measure on both arms and consistently check on the one that's the highest arm. What about low TSH? Can it cause high blood pressure and a racing heart? If you have low TSH and you're not on thyroid replacement therapy, then possibly. So then you need to look at your free T4 levels, free T3 levels, reverse T3 levels, and then potentially have a thyroid ultrasound to look for a hot nodule. So if you have an overactive thyroid, then yes, it can drive racing heart and high blood pressure. Ask the question, does LDL measure matter? I don't know exactly what you mean by measure matter, but if you're asking about LDL cholesterol, not as much as LDL particle. So I always look at LDL cholesterol because it's included in the report, but you generally want to have an LDL direct. Most labs still just do a calculated LDL cholesterol, so it really depends on what your triglycerides are if you're going to have a reasonable, accurate, estimated LDL cholesterol. But cholesterol is just the passenger inside the lipoproteins. So it's much more important to know about how many lipoproteins carry the cholesterol through your vascular system than it is the total cholesterol, or the LDL cholesterol for that matter. So no, it doesn't matter as much, but if you're looking at a traditional lipid panel and your LDL cholesterol is north of 190 milligrams per deciliter, and it has always been that way for the most part, then you very likely have familial hyperlipidemia and may want to do genetic testing to figure out which variant of familial hyperlipidemia you have. Sometimes it matters, but other times you just ultimately use multiple lipid-lowering therapies to get the person to their LDL particle goals. Is there any way to find out if blue light is affecting me? It completely depends on, what symptoms you may be having, if you have anything. Blue light is absorbed by the opsins in your eyes and skin. So if you have issues with your eyes, if you need contacts or glasses, blue light probably had some effect on it. If you have insulin resistance, blue light probably has an effect on that. If you don't sleep well, blue light almost always just really affects your cortisol levels in that instance. So can't tell you for sure, but if you're not sleeping well, if you don't have perfect glucose control, if you have issues with your migraines, your eyes, then yes, blue light probably does affect you. Causes for abnormal blood pressure. Hikes when standing for too long. It would sort of depend. It depends if you have any issues with POTS, postural orthostatic tachycardia syndrome. Generally, blood pressure lowers in that instance. So, if it's spiking, are you anemic? Do you have a thyroid issue? Do you have venous insufficiency and blood is pooling in your legs, and then your body's just compensating by trying to raise the blood pressure so you don't pass out? So physical exam, lab work is really what's generally required to figure out the root cause of that. And you generally want to do a orthostatic assessment where you check your blood pressure lying, seated, and standing, and seeing if there's any difference in those situations. What is the relationship between muscle strength and blood pressure? I don't know exactly what the question is per se, but muscle strength is very correlated with longevity. Blood pressure, if you're generally more physically fit, you generally should have better blood pressure because you're forcing blood across the glycocalyx, and the glycocalyx will inform the endothelium to release more nitric oxide. Generally, it's going to help keep inflammation, oxidative stress low. So I personally don't know if there's studies that directly correlate, if you're absolutely stronger by a strength metric and you have more normal blood pressure. But typically what I see is the stronger the person, it depends. But if they're the bodybuilding type and they're strong, they often have sleep apnea and it's not well treated. Blood pressure's higher. Many of them don't recover very well. They have tons of inflammation. Blood pressure goes up. So muscle strength probably doesn't directly correlate to low blood pressure all the time and may correlate with higher blood pressure in certain individuals. Can having the flu cause your heart to race? Absolutely. I just had a patient the other week have influenza, and it kicked him into atrial fibrillation. So, it just causes oxidative stress and inflammation, and the atria are kind of the canaries in the coal mine sensing that oxidative stress and inflammation, and the atria can then start firing off premature atrial contractions, runs a supraventricular tachycardia, or get stuck in atrial fibrillation. So I'd have to know, in what context, but is it normal for blood pressure to go up and heart rate to stay normal? It depends if you're saying if you're from a seated to a standing position. No, generally they both somewhat will change. And heart rate to be normal depends what you mean by normal. Go to a normal sinus rhythm is between 60 and 100 beats per minute. Generally, if you stand up, the heart rate's not going to stay exactly the same. The blood pressure usually, stays relatively the same. It may drop slightly. Is it dangerous? Unknown. Would need to know what else is going on with the cardiovascular system. Are you symptomatic? You always start with that. If you're not symptomatic, probably doesn't mean much, but if you're having headaches, vision change, chest pain, shortness of breath, heart failure, okay, then yeah, it probably is a problem, needs a further workup. All right, guys, we're getting to the bottom of the hour, and I think I got through all those comments as well. So always appreciate your guys' time and attention. I'll work on the next day or two to get my archives from my previous two AMAs up on my Instagram channel. I'm sorry, my YouTube channel. My channel is just drtwyman.tv. There is a kind of a heart attack and stroke prevention summit coming up at the end of the month. If you're on my newsletter, I did send out one the other week that talked about it. I'll send out another newsletter this week. If you're not signed up for my newsletter, you can just go to my website, drtwyman.com. It's in the process of me getting back into the swing of things to generally write, at least a monthly, but going for a goal of a weekly letter in the near future. I was a little bit more active 2 years ago writing letters, and then just life got in the way, and the practice got very busy because a lot of you guys watch and come in to see us, and so busy taking care of you guys one-on-one. But I'm going to get back into doing some more of the newsletters, trying to educate. So if you're not already on the newsletter list, go to my website, drtwyman.com. There's a box at the bottom that lets you sign up for it. So appreciate your guys' time and attention. I'll be back here next Monday, 6 p.m. Central Time.